So, if you are a woman and you've wondered why every time you've tried a sleep tip or a sleep hygiene recommendation that maybe your husband or your brother have tried and it doesn't work for you, you're not alone. The reason why it's not working for you is that the sleep in men and women are completely different. And this is what we're going to be talking about today. We're going to be delving into the difference between sleep in men as well as women. And this is not just about menopause, because many times when we hear about sleep in women, one of the things we talk about is, okay, menopause. But even beyond that, we're going to be delving into about four differences between sleeping men and sleeping women. So if you do not know me, I'm Dr. Funke Afolabi Brown. I'm the founder of Restful Sleep MD and the Restful Sleep Place, and our mission is to make sleep a thing. All right, so we're going to really get started, but if you have never, if you stumbled upon this show, you want to hit that subscribe button, because I do not talk fluff. I bring weekly content that is valuable to improve your sleep or sleep in your family, right? So, all right, so talking about this really, I mean, the main issue with sleep in women is that there are many variations, right, along the lifespan. So we're going to talk about that. There are also some structural differences. We're going to cover that as well. But I think at the end of the day, one of the main issues that really frustrates me in my practice, and also especially when I see people coming to see me either for a second opinion and things like that, is many times we make assumptions with sleep regard for women, and we just, based on that, really give them the wrong treatment sometimes, or delay treatment. I can't tell you how many times women have come in and they said, well, I've had all the sleep issues. My doctor said it was depression, and I've been on all these many depression medications and nothing is getting better. And then we do a test and find out they either have restless leg syndrome or sleep apnea or something in between. And so I think it's really important to be able to highlight what those differences are, because that will help you understand your biology a little bit different. And when you understand what's going on with your body, you can actually seek out help quickly, knowing that treatment options exist. Okay. Number one, the big difference is really around the hormones, right? The hormonal roller coaster, I would call it. And again, this is not just about you being done with, periods and then menopause. This is even with your periods. So one thing we know is that the monthly cycle, sleep changes around then. What is going on? There are two main hormones we usually talk about. One is estrogen and one is progesterone. So here is what's going on. Within that, the first period, the first part of your period, right? Before ovulation and all of that, your sleep might be good. Estrogen is high. That is great. And then by the time you start to approach having your actual period, you start to get a dip in those hormones, especially with like estrogen. So even though your progesterone may be going up, you might start to see a decrease. And what that ends up doing is that it starts to cause fluctuations in your sleep quality. You may start to feel that you have some more insomnia. And so because of that, many women will report that the first week or the week just before their period, their sleep is horrible. And then around when they're having their ovulation, before then, their sleep is good. So why is this important? It's important because now you know that, okay, the first 2 weeks of my cycle, I might actually be okay. I could try to take advantage of that. And then the second 2 weeks or the second week or the latter week, you may notice, okay, I'm having sleep struggles, and knowing because those hormonal changes exist, you need to be more intentional about your sleep schedule, more intentional about your sleep habits and things like that, because you're going to need extra help. So I would say one thing you could do, a pro tip, is try to track your sleep patterns before your period, track your sleep patterns after your period, track your sleep patterns around ovulation, and you're going to start to see some trends. And so based on those trends, you can now make adjustments to optimize your sleep. So that's the first part when it comes to hormones, just the monthly cycles alone. The second thing is pregnancy, right? That's a huge hormonal shift going on there. And with pregnancy, there are three trimesters: the first trimester, the second trimester, the third trimester. Usually the first trimester, people are very sleepy. Why? Because your hormones are rapidly rising. Progesterone is going up. And so most women, in fact, expect that women can sleep literally standing up. They're that exhausted. Exhaustion is overwhelming, right? All those shifts are really causing exhaustion, and you're really starting to feel sleepy as your hormones rise. By the time you get to third trimester, there's starting to be fluctuations, but beyond that, there's also the size of the baby. The baby is getting bigger. You might start to have a little bit of pelvic pain, back pain, maybe restless leg symptoms, and you'll start to notice sleep disturbances emerge again. Again, be aware of those shifts so that you know where you need the most support. So those are the main things. So we talked about monthly cycle. We talked about pregnancy. The third thing is menopause and perimenopause. So those hormones we're talking about, the progesterone, the estrogen, they're now starting to really literally like crash, right? There's ups and downs and oscillations, and your sleep feels like a roller coaster. So you might think something is going on with my sleep. I'm having these hot flashes, or I'm not even having hot flashes, but I'm just having a hard time sleeping. It is literally not just in your head. You're not making it up. This is really your biology, your physiology that's really trying to work against you. But again, an awareness of where these things are coming from will help you to know exactly what you need to do to make the right shifts so that you can get the support that you need. So another thing I would say is that with menopause and perimenopause, again, because of those hormonal changes, you're going to actually see changes in your sleep architecture. So you may notice you're not getting as much deep sleep. You may not notice that you're getting more light sleep. It's easier for you to wake up. These are all the things that we would expect to happen because, again, those shifts are happening. And this is something that is very common. All right. So we talked about hormones, right? Hormones, including the monthly cycle, pregnancy, menopause, perimenopause. Let's jump into sleep disorders. Now, this is a big category, and there's huge differences, again, with men versus women, right? The first one is hormones. Men don't get these fluctuations in their hormones. They don't get cycles. They don't get pregnant. They don't get into menopause, right? So that's one huge difference. The second thing is the sleep disorders. So let's talk about the most common, the one that we commonly see, sleep apnea. A man will go to the doctor and say, I'm having sleep issues. Maybe I'm snoring. I'm waking up tired. He will leave, hopefully, many times with a sleep study. A woman will go in and say, I'm having sleep issues. I don't know what's going on. Most times she will leave with a pill for depression, an antidepressant, right? Why? Because the presentation is often different. For men, they may present again with loud snoring, they're sleepy during the day, maybe they're overweight, all of those things, they're waking up, their mouth is dry, all of those things. So it seems a little bit more classic. With women, we tend to present more subtle, maybe a little bit of fatigue, malaise, fogginess. You may feel a little bit depressed. You may wake up and you're waking up tired and unrefreshed. Another one that I see a lot of women present with is that, again, disorientation and difficulties focusing, right? Those symptoms sound very much like depression, except for many women, it might not be depression. And so because of that, we often get missed. And then the other piece is the way apnea presents in men. A lot of men will have what we call full apnea, meaning they have collapse of their airway, nothing is moving, they have the snoring, the gasping, those patterns of breathing. Women have more of a partial collapse. So they have very subtle interruptions in their breathing, right? And so because of that, they may not have like large apnea-hypopnea index, which is what we use to quantify the severity of sleep apnea. They may have what we call upper airway resistance syndrome. And so those symptoms they're having might be because of this sleep disordered breathing or sleep apnea or upper airway resistance syndrome. So again, it's sort of a spectrum and not black or white. So because of that, it is so important that women who are waking up unrefreshed, waking up tired, please reach out for help because you might have sleep apnea that needs to absolutely be treated. And then the other piece I would say is the treatment of sleep apnea, right? For many men, treatment usually is CPAP and you just get going, you figure it out. For women, many times they need either very major tweaking in their CPAP pressures, and I've done a few videos on CPAP and all of that. They may need adjustment of their masks. I cannot tell you how many women are with the wrong mask, and because of that, they're not able to get the benefit when their sleep apnea gets treated. And then they may need to explore other options, oral appliances, weight loss management, sometimes medication, things like that. So there's such a wide array of treatment options that are available that many women are not taking taken advantage of. And as a result of that, they're going around with untreated sleep apnea. Another disorder is restless leg syndrome. So with pregnancy, but not just with pregnancy, just women generally are more frequently diagnosed with restless leg syndrome than men. And women in pregnancy may be almost twice as likely to have diagnosis of restless leg syndrome. And these are those creepy, crawly, weird discomforts that you have in your legs or your arms during sleep, which makes it really hard to fall asleep. So again, this is a disorder we want to check in on. If you're having these symptoms, it's going to make it hard for you to fall asleep and sometimes to stay asleep. And you may get some blood work done. Simple blood tests to check a ferritin, magnesium, and all of that may actually be the clue and ensure that that is getting treated. Because if you have restless leg syndrome, you're probably going to have a hard time with sleep as well. What else? Another thing I would say we want to consider as a possible difference when it comes to symptoms in women is the insomnia, right? A lot of women have constant ruminating thoughts. They tend to have a whole lot going on their schedule. And as a result of that, they have a hard time with sleep. So women tend to have more insomnia. Men also have it, but you may tend to see it present more in women where they have difficulties falling asleep, difficulties staying asleep, lots of thoughts, lots of catastrophizing, lots of rumination. And so that is something else that we want to make sure that we are addressing, because compared to men, you may tend to see that women are just juggling so many responsibilities. I mean, men are juggling them as well, but these things can contribute to insomnia. And the treatment for insomnia, usually the gold standard treatment we talk about is cognitive behavioral therapy for insomnia. But in some situations, medication management, supplements, all those things exist. And so that's another disorder that we really want to watch out for, because the manifestation and the presentation may be a little bit different in women compared to men. So the next one I want to talk about, this is a very important one. These are circadian rhythm issues, right? What is that circadian rhythm? It's that internal clock that really dictates when you wake up, when you go to sleep. It responds to a substance in your brain called melatonin that helps you to know when you're supposed to sleep, when you're supposed to start to feel sleepy, and then when you wake up. Now, for women, there's a slight difference in their circadian, in the way their circadian rhythms work. It's a little bit shorter than in men. And so you may tend to find a woman who is more of a night owl. It was more of a morning lark, not a night owl, right? You may notice that women may wake up slightly earlier than men. And so if they have trouble sleeping and then they wake up earlier, you can imagine that their sleep struggles are going to emerge. Another thing that you might also notice is women are also more sensitive to light. And how does that impact? So environmental changes. If there's light outside, if there's light in the room, if there's a phone, women tend to have more of a response to that. And it makes it even harder for them to sleep. And then the other piece you have to think about is seasonal disorders, right? When you have depression, seasonal affective disorders, right? Such that in the fall or in the winter, women tend to have more depression because of that sensitivity to light. And as a result of that, they may tend to have more sleep struggles. So that's another big one. Those circadian differences are huge when you're differentiating sleep in women compared to men. And then the fourth one, right? I talked about hormone, we talked about sleep disorders, we talked about circadian issues, and now the fourth one is life. Women tend to do life a little bit differently than men, you would say, right? Care for the kids, multiple care for, aged loved ones, work, so many responsibilities. Women tend to have a lot more responsibilities. Now, again, I'm not saying this is not the same with men. I'm just highlighting differences that we've seen in research, and I've also seen in my clinical practice. So multiple things that you're juggling as a woman, the likelihood that you're going to be able to go to bed at 9:30 or 9 p.m. is less a little bit, because you're finishing homework, you're finishing up with, taking care of the kitchen or things like that, right? So there tend to be a lot more on our plate overall. And as a result of that, that might eat into our sleep time. So imagine that you have all those responsibilities. It's going to eat into your sleep time. And then maybe you're one of those women who are like, I've had a horrible, busy day, and I just need to veg out. And then you engage in revenge bedtime procrastination. And then that further decreases your total sleep. So you can see that There's huge differences. So me telling you to just get into bed, get out of bed, and giving you blank sleep hygiene statements are great, but they may not be helpful for you as a woman the same way it would help a man, because these differences exist. So what can we do? Knowing that these differences exist, there's still hope. A few things I would recommend is your sleep has to be an intentional experience. You have to be, it's not just going to happen magically, because see all the things we talked about that could go wrong, right? It's not going to happen magically. Track your sleep, look at your sleep cycles, and see what your sleep patterns look like. Adjust your sleep behaviors to support your sleep cycles based on your mental cycles and things like that. So make those adjustments. Work on your routines. Women may tend to need a little bit more time to just wind down. So being intentional about your bedtime routine is also something that is going to be very, very critical. And then another thing is temperature regulation. Your bedroom has to be cool, especially for women in perimenopause and menopause who are suffering from the hot flashes and the night sweats. I mean, some women swear by a bowl of ice and a washcloth right by their bed. You want to make sure your bedroom is cool, between 65 and probably about 70 degrees or even cooler. You want to make sure that you're wearing moisture wicking pajamas. Again, you may need to get the AC on, the fan on, to try to create that environment to be as cool for you as possible. And then another thing is stress management. And yes, you may not be able to eliminate all the stress, but there's strategies you can put in place to manage your stress, right? Mindfulness-based exercises, creating boundaries, progressive muscle relaxation. There's a whole lot of stuff that we talk about in other videos around curbing the mind racing and things like that. And then it's so critical to reach out for help. Don't wait until things are falling apart. Remember, I said you are more likely to be diagnosed with depression than sleep apnea. So push and be that advocate. Get your diagnosis, get your sleep study, ask for a sleep study. And if they give you a sleep study and they say, oh, it's just normal, a little very mild sleep apnea, please ask for treatment options. Okay, I get it. It's mild sleep apnea, but I feel horrible. So get the treatment. There's so many treatment options available. If you have insomnia, cognitive behavioral therapy for insomnia is readily available. And so it's really important to engage in that. You could do some online courses, or you could see a clinician who will administer it. In some situations, you might need medication, you might need supplements. So it's important to make sure you're working with people who are on your team and want you to succeed from a sleep perspective. So really, really critical to get the help you need. This is literally a video I've been longing to do, and I'm so glad I was able to put it out here, because there is help for you. Your sleep is different, so what you're feeling is not just in your head, but there is help readily available for you. And if you're ready and you're like at that point where you're like, you know what, I'm all in. I think I am tired of trying to do this on my own, Dr. Brown. I would love for you to jump on and just help me and be on this journey with us. Give us a call. We will be more than happy to help. We help individuals, including women, children, men, and families, to optimize their sleep, going the root cause route, figuring out what the underlying issue is, going from a very holistic perspective to determine what is going on. And we are here to make sure that you feel seen as a woman, you feel heard, and you feel cared for, because sleep is such a critical pillar of your health. And if sleep is awry, if sleep is in short supply, you're not going to thrive, and we want you to thrive. So give us a call today, 215-607-8297. We'll be more than happy to welcome you into our Restful Sleep Place family. And then share this with any woman in your world. You can see the things I talked about. It's not just pregnancy. It's not just menopause. It's everything in between. So get this word out there with me. Help me to reach as many people. Share this video, bookmark it. You're going to come to listen. If you have a doctor who's like, I don't know, send this video to them, right? And so that we can really start to thrive using sleep as a superpower. And so until next time, my friends, I hope you rest well.